So moving on to the next question. My uncle was hospitalized with severe pneumonia, and now the doctors say he needs to be put on a ventilator because he's struggling to breathe. How serious is this, and what are his chances of recovery?
So looks like he has a severe pneumonia episode, and maybe he's going towards something what we call as ARDS, which is Acute Respiratory Distress Syndrome. So ARDS is so think like I always tell my patients, lungs are like sponge tissue, and the airway is kind of an inverted tree, kind of branching into the lungs. So it's basically that's how we typically understand lungs, and then the sponge tissue kind of is taking in air and kind of giving out to the body all the oxygen you breathe in and giving out carbon dioxide, right? So the sponge, when it gets sick with basically the spongy tissue, when it gets sick with pneumonia, what happens is there's a lot of this kind of a muddy, inflamed fluid kind of drip filling into the spongy tissue and make it so not flexible. So typically lung is very compliant or flexible, and the ARDS is doing the opposite. So ARDS is kind of a clinical diagnosis and can be due to multiple things. Commonest cause is pneumonia, but people who have pancreatitis or severe sepsis with multiple organ involvement, all those people go into ARDS. And when they go into ARDS, the problem is the lungs are so stiff, and because this boggy fluid. And then what happens is you are ending up on a ventilator requiring a lot of oxygen support, a lot of pressure support. So you need to give high pressures to open up that lung and get rid of that fluid and get oxygen going and carbon dioxide getting out. So the good thing is we have new things over past 24 years to help the ARDS syndrome, but it still kills a lot of people. Almost half of them still die if they have severe ARDS.